associate needed in Tennessee to help our amazing Job Connect client, Dr. Mark, unlock more growth, more freedom, more flexibility, maybe fewer hygiene checks too, Dr. Mark. Share with us here, why are you looking for an associate dentist and where are you guys located?
We just had a dentist that's relocated, and we're needing to replace that dentist. They were making around 435,000 when
Wow.
they left. Yeah. So we've got a unique opportunity in Jackson. It's we've got a multi-specialty clinic where a lot of high volume, no Medicaid whatsoever, a lot of patients, and this is a position for someone that's looking to find their full potential and what they
Awesome.
can do. Yeah, we've got three locations in West Tennessee, and this is in our Jackson location that we're needing another dentist. We have one general dentist here now that's keeping things up until we bring the second one back on. But we had two general dentists at one time, both of them making anywhere from 300,000 for our younger dentist up to 450, 500,000 for our more mature, experienced dentist.
Awesome.
So
I mean, what
yeah.
I do and hope to educate my community with is replacing a dentist who's leaving for a good reason is one of the best reasons to have a job, right? During the pandemic, one of my associates, Dr. Mark, said, I'm moving to San Francisco because my wife got into a medical residency. So we need to replace him, and he had a schedule. And, when you can replace someone who's leaving for a good reason, it's an awesome opportunity for someone to step in. So we have the where, we have the why. Tell me about the what. What procedures is this associate expected to do most of the time? And then you can add in maybe there's opportunities to do specialty procedures as well. Tell us about that.
So we have specialists here. We have oral surgeons. We have orthodontists. We have uh, the general dentist doing the pedo patients. We're looking for just a well-rounded general dentist that can do lots of things. Molar endo would be awesome. That's a very difficult thing for us to find people in West Tennessee to do molar endo, and so those that can are swamped with it. Lots of crowns, bridges, restorative of all types, so dentures, just well-rounded. Restoring implants. Uh, it. The nice thing about this clinic is we're really high on mentorship
Cool.
because we have the specialist here. Our specialists are willing to get in and really work with the general dentist and help them learn all the different things. I've been doing this for 34 years. I'm a general dentist. I do nothing but ortho now, but I've done pedo in the past. I've done a lot of different things. And so we're here to help those dentists find their full potential.
I always say this, the more ortho you do, the smarter you are, like you, Dr. Mark. You want to know why? No injections, right? No injections. You don't have to come at anybody with lidocaine anymore. So good job. People probably look at you more favorably when you come at them with wires, brackets, or clear aligners. So good job stepping out of I don't want to see the Dr. Mark to do my filling to now I want to get my teeth straightened. So I compliment you on that. So it sounds like you guys do almost every type of procedure in the office there. So we've talked about, why you're looking for an associate, where is the job, what they're going to do, how will they be compensated? I know you alluded to replacing someone making over $400,000 a year, but dentists like details, kind of just deepen the details on compensation.
Sure. 30% as an employee on collections.
And you have a track record, that's why I tell you have a track record of, it sounds like the previous associates collecting over $1 million a year. And are they working mainly 5 days a week, 4 days a week, 6 days a week? How many days a week are your associates working?
4 to 5 days a week. The one that left was doing 435,000 on 4 days a week, 9 to 5.
Awesome. So normal hours there. I like that. Now, I always say this sort of as I start to wrap up. Dentists are people too. We're people too. Not many people think we're people, Mark, but we're people, right? We thought our teachers lived in the back of the classroom. They didn't. I think some of our patients think we live in the operatory. So now I don't want to hear, now I don't want to talk about dentistry. I want to talk about dentists being people. They finish up their day in Tennessee and they're going to do something at night. They're going to do something on the weekends. If you were a 33-year-old moving to take this job saying, listen, I can get mentored. I can be in a great group practice. I can produce patient-centered care, but I do need to do things outside of the office. What would you do for fun?
So West Tennessee is one of those unique areas in that it gives you the ability to find your potential, make the most amount of money that you can find in the United States, basically. But the nice thing about Jackson, Tennessee is very low cost.
Cool.
housing out here is incredibly affordable. This is very family-oriented communities. You can do some of the best private schools in the state are in this location and get them fairly reasonable, around $10,000 a year per child, which compared to Nashville, Tennessee, they're running 30, 40,000.
Yeah.
You know, a house in Nashville, Tennessee for a, you know, $3,000 house will cost you $1 million. Here in Jackson, Tennessee, you can get huge houses for, you know, a lot of affordable things to do in this area. That's the nice thing about West Tennessee. Outdoor things. We're close to Kentucky Lake, Pickwick Lake, hunting, fishing, outdoor, and we're only an hour from Memphis. So we're kind of like a suburb of Memphis, about an hour away now. And we're 2 hours from Nashville. So we're right in between the two cities. So if you can jump on a plane quickly in Memphis or Nashville and go anywhere in the world, but be able to come home and afford whatever you want to be able to afford.
Yeah, it sounds like you've created a really amazing opportunity. And, you know, we've gone through the why, where, when, and how, but also just the mentorship piece. It sounds like your dentists are collaborative. You know, how is that? If you were a newish dentist taking this job or a medium-aged dentist, I find that dentistry can be a lonely profession, even though you're surrounded by people. And when you have other dentists that have your back, tell us about how the other dentists will have their back there.
Yeah, we're all in one little office there. We completely coordinate all treatment. You can sit there and talk with the oral surgeons who we've got are fantastic. They're full scope MD oral surgeons. You can talk about all the different cases. We've got them on speed dial when they're not in the office. I sit there and talk general dentistry and ortho with them all the time. We've got the other general dentists there. So I have my ability to do IV sedation also.
Nice.
So for the folks that are looking for IV sedation, you know, I can mentor them. That there's really nothing that we can't mentor them for, and we do consistently. It's just really a nice atmosphere to sit and be able to converse with all the different specialties in general dentist. So if you're somebody that's looking for, you know, you kind of a little bit iffy about your skills, that's not a problem. We walk through those two different things. We want you to be able to do all these different procedures. And
I mean, it's amazing. Just, you know, dentistry is a difficult profession. You know, medicine, it's very normal to have a group of doctors working on one case together and the patient thinks I'm getting the best care. And I think it's actually poignant and difficult because, you know, someone coming in to help you with a case, it doesn't mean you don't know what you're doing. It just means you want the best result possible. And it sounds like you've created that environment inside of this office.
we have, and we use CEREC to scan for crowns. We use CEREC for ortho. We've got cone beams. So patient comes in. We actually see the sickest patients in for oral surgery in West Tennessee. So these folks come in with all types of medical history problems, and our oral surgeons are able to see it. And the general dentists get from that too. They can see that these patients can be seen. They don't just have to be pushed away some corner. And
Awesome.
it's nice to be able to. We actually even have a CRNA that comes in and puts our children to sleep for us and our special needs patients so that we can work on those also.
I mean, I tell dentists of all ages and stages, but especially earlier in your career, Mark. I graduated in 2002. Early in your career, when you're in a place where good dentistry is happening, when you're in a place where cool things are happening, and even if it isn't your goal to sedate people, the fact that you're in an environment where you're learning this and seeing this in other operatories, it elevates you as a professional and practitioner. So I'm so thrilled to have you on Dentist Job Connect. People can apply by going to dentistjobconnect.com. They can also text Jackson to 215-798-9897. Thanks so much for sharing with us today, Dr. Mark.
Thank you.